Hello, I'm Sheryl McCarthy of the City University of New York. Welcome to One to One. Remember the 1980s when the specter of HIV infection and AIDS hung over the country like a medieval plague? When it was personal because every one of us knew someone who was either HIV positive, had developed the disease, was dying, or had died from it? Fortunately, advances in science and medicine have made HIV/AIDS less of a scourge and less of a certain death sentence, and hardly anybody seems to talk about it anymore. But that doesn't mean it has gone away. So what is the status of the disease today? How many Americans are affected by it? Who are they? Who's at risk? And what more needs to be done to combat the disease? Sharen Duke is Executive Director and CEO of the Alliance for Positive Change, which for 27 years has been working to improve the lives of those living with or at risk for HIV/AIDS. She'll bring us up to date on what the situation is now and what her organization is doing about it. Welcome.
Thank you.
As I said, the HIV/AIDS epidemic was a huge national crisis in the 1980s, but hardly anybody talks about it anymore. How would you describe the current state of the disease?
Well, because of the treatment advances that have occurred, people are living long, full lives, truly surviving and thriving with HIV, and are able to do many more things than they were in the past. 25 years ago, people were dying. We were going to memorials all the time. There was a lot.
It was a death sentence.
It was a death sentence.
Yeah.
It was there, and there was fear and bigotry and shame. And so, fast forward 25 years later, with the treatment advances, people are making positive changes in their lives, and that's what our organization is all about: helping New Yorkers make lasting positive change towards health, housing, recovery, self-sufficiency as they navigate life with HIV and other chronic conditions.
The figure that I read is that there are currently about 1.2 million nationally who are diagnosed with HIV/AIDS. How many in New York City?
In New York City, there's about over 86,000 New Yorkers who are living with HIV. Mm-hmm. Statewide, it's over 123,000.
Okay.
So about 76% live in New York City.
New York City have the highest numbers, or are there more in San Francisco, or do you know?
I don't know explicitly, but New York City is absolutely one of the epicenters of the AIDS epidemic in the country. Mm-hmm. And we also have one of the most sophisticated health and social service systems to combat AIDS.
Right.
In large measure because of strides that have been made and resources that have been allocated by our city and state government, the legislature, city health department, state health department, and New York City Council. And most recently, Governor Cuomo, creating the blueprint to end the AIDS epidemic in New York State by 2020. We have been, for the past 25 years, working to create an integrated system of care for people who are living with the virus. And I think that models of HIV care are truly what have become a model of chronic disease management. And so at the Alliance, we were initially formed as the Lower Manhattan AIDS Task Force in the early 1990s. And over the past 27 years, we've evolved into a multi-service, multilingual, multi-site, multi-million-dollar organization serving people living with HIV, at risk for HIV, and also facing other chronic conditions like hepatitis, hypertension, obesity. And so we've taken our 25 years of experience doing the HIV work and have been applying it to other chronic conditions.
So what does Cuomo's initiative add to what?
Well, what Governor Cuomo has done is he called upon the expertise of community leaders, doctors, organizations like mine. I was on his task force to end the AIDS epidemic, and essentially said to us, you have the knowledge, you have the skills, what are the resources, and let's put a plan together. So it's a three-pronged approach to decrease new infections, currently from 3,000 statewide in New York State.
Each year?
No, over the 5 years, to decrease
Okay.
the 3,000 new infections to 750 new infections, which would be below the epidemic proportions as defined by the CDC. So you want to decrease new infections. You want to increase viral load suppression. What viral load suppression means is that people who are living with the virus have copies of the virus in their bloodstream. And if you are virally suppressed because you are taking your medications regularly, then you are not going to be able to transmit the virus. So if you create viral load suppression in just one person, you are both improving their health and you are also contributing to decreasing new infections.
Right. Now you said 3,000 is considered the epidemic level.
Proportions, yes.
So we are still at that now, or are we not? Are we at that?
We are actually slightly below 3,000. New infections, but we are still at epidemic proportions. We have not hit the 750. We would have to reduce new infections by 75% in order for HIV to no longer be an epidemic.
So that's 3,000 new diagnoses
in New York State.
In New York State per year.
Per year.
Okay.
And our goal is to decrease that.
Okay. But new diagnoses have been going down, correct, over the years?
They have been going down.
Okay.
And part of that is in response to treatment as prevention, to social service and medical advances and integrated systems of care.
Right.
To help people. You know, the first step in preventing HIV is knowing where you stand. So the importance of getting tested, knowing your status, and connecting to medical care is what is enabling us to really battle the HIV.
And deaths obviously have been going down.
Deaths have been going down, although sadly they do continue.
Do we have an idea how many per year in the city or the state?
I'm sorry, I don't have that data.
Okay. So
I can find out for you.
Okay. So the demographics of your constituency, gay and bisexual men, especially young gay and bisexual black men, correct?
Correct.
So, and I read that African Americans are 12% of the U.S. population, but 45% of HIV diagnoses, most of those, again, young African American males. Do we know why that is?
I think that the HIV epidemic has always been an epidemic of minority communities, and a majority of the people infected with HIV have always been people of color.
Really?
That is from the origins of the epidemic, yes.
Because in the early days, I mean, it was associated with white gay men. Was that incorrect?
It's not that it was incorrect. It's that the white gay men were, because of economic stature, were often in medical care and were early diagnoses. But the epidemic soon spread into minority communities, and while it remains a challenge for white gay men, it is predominantly people of color are living with HIV.
Okay.
And what we're seeing more recently is, despite our prevention efforts, young gay men, black and Hispanic, with MSM, so you don't always have to identify as gay or bisexual, but to have sex with men, men who have sex with other men, and particularly young MSM, are at very high risk for HIV and is a fastest growing group of new infections.
Is that because they're not engaging in safe sex, taking the preventive measures? Is that why? Do we have any idea why that might be?
I think that in part it is because of unsafe sexual practices. I also think that youth feel a sense of invincibility, and that our educational messages have not been as explicit as they need to be, and are not reaching all of the communities that they need to reach.
Right.
However, there have been advances in prevention, which is called treatment as prevention, and so there's PEP and PrEP, which is prophylactic medications that you can take if you think that you have been exposed to HIV. And part of Governor Cuomo's...
Is that sort of like a morning after medication?
It's sort of like a morning after medication,
yeah.
Yes. And so there's some really interesting endeavors that the city has taken on. The City Health Department actually engaged my organization in a project to use peer navigators to connect people to navigate people from STD clinics to HIV prevention medications. so that we can both decrease sexually transmitted infections and also decrease new HIV infections.
It's interesting, at the height of the AIDS, in the 80s, and I guess this was a push from the homosexual community, an effort to say, okay, we're not the only ones who get the disease. Heterosexuals get the disease. You can get the disease through injecting drugs. Women get the disease from their male partners. But in fact, it has always been predominantly a disease of gay and bisexual men. Is that correct? Predominantly.
Predominantly, although there is a significant portion of women who have been infected, and women of color continue to be a priority for us to reach and ensure that they have access to the treatment and care that they need and deserve. I also think that there's a lot of stigma in our society against substance users, and at the Alliance for Positive Change, we recently merged with the Lower East Side Harm Reduction Center, which is one of the first needle exchange programs in the city of New York. And what we're very proud of is that rates of new infections among injection drug users have declined. And I believe that the reason for the decline is the availability of clean needles at needle exchanges like at the Lower East Side Harm Reduction Center.
Okay. I remember hearing from, I guess these are people who worked at drug treatment kinds of facilities, saying that, you know, some of the new cases they were seeing were in older people. I suspect that's not a large percentage of the people with diagnosis, but it was something that I was hearing for a while.
Well, because of the treatment advances, the HIV population of people living with the virus is aging.
Yeah.
And there is a growing number of folks living with HIV who are over the age of 50, if we consider that an older adult.
Right. The alliance was formed in 1990. Is it an alliance? What kind of alliance? What does that mean?
Well, for us, we feel that we are creating an alliance of consumers, of doctors, of peer navigators, of social workers, of funders, of politicians coming together to create opportunities for people to make positive changes in their lives. And when the Alliance was initially formed 27 years ago, we were explicitly formed to combat the AIDS epidemic in New York City, in Lower Manhattan. And
has your focus changed since then?
Well, particularly in starting in 2012, when there was the beginning of Medicaid redesign, there were opportunities for AIDS organizations to take their model of HIV care management and apply it to chronic disease management more broadly. And so under President Obama's Affordable Care Act, New York State created what are called health homes for people on Medicaid. And that is to navigate those folks to get all of the services they need: medical, social support, housing. And
anybody on Medicaid?
With 2 or more chronic conditions.
Okay.
And so at the Alliance, what we have done is we've realized that our area of specialization is really around both HIV infection and behavioral health, be it mental health or substance abuse issues. And our model is really based on a peer-to-peer education approach to care.
Okay.
I think that one of the things that makes the Alliance really unique is our peer education model. It's really towards economic development and social impact through role modeling. If you've heard of Weight Watchers, where the team leaders are people who have done the Weight Watcher program, well, for the Alliance, our peer navigators are people who have shared lived experience, who have gone through our training program, and are now willing to give back to others. And so they role model healthy behaviors and healthy choices. And because they are of the community that we are serving, they are really powerful messengers of prevention and the importance of getting in care and sticking to your meds.
We'll talk more about that after a short break. We'll be back with Sharen Duke, CEO and Executive Director of the Alliance for Positive Change, after this message. Welcome back to One to One. I'm Sheryl McCarthy of the City University of New York, and I'm talking with Sharen Duke, Executive Director of the Alliance for Positive Change. You were talking about your peer counseling program. So these are people who are living with HIV/AIDS and who know how to live with it and are counseling others so that they can live better with it?
Yes. For us, the peer education and training program is the heart and soul of the organization. Our peer educators are living proof that you can transform challenge into positive change. And at the Alliance, we say stand up, clean up, rise up. People have the courage to walk through our doors and to say that they need help. And then we provide the support and they make the changes in their lives. And for some, they choose to give back. And those are the peer educators. The state health department, under Governor Cuomo's blueprint and the AIDS epidemic, has created peer certification training. Mm-hmm. And at the Alliance, we have really been working to develop our own peer workforce.
And is this a full-time job for them, or?
It starts out as a part-time internship, up to 20 hours per week. And that's where the peer educators who are former clients with skills and knowledge and training are able to help others. So some peers do what we call outreach and case finding and linkage to care. Mm-hmm. We have a program with managed care companies where we go out into communities to find folks who have fallen out of care and to re-engage them with their medical doctors. Peer educators also provide navigation and support as part of care management teams. So the peers will go with social workers and in doctors' offices, they'll do reminder phone calls, accompany people to the doctor, coach them on taking their medications and talking to their doctors about challenges that they're facing. So it's community education, it's community leadership, and it's really about transformation.
And you have, is it 90 peer counselors at the moment?
We actually have over 160 peer educators and paid internships each year.
So now you also offer AIDS testing at your facilities. It's free, correct?
It's free, it's confidential, and it's the rapid HIV test, and we also offer the rapid Hep C test, hepatitis C.
So you can find out within
25 minutes.
Okay.
And then one of the things that we are very proud of is that we have priority partnerships with some of the biggest and best hospitals in the city, with New York Presbyterian Hospital, with Mount Sinai. We also work with community health centers, the Institute for Family
So
Health.
Anyone who wants to get an HIV test can get it free?
They can get it free at the Alliance. And the Alliance, we also have community centers in Washington Heights and East Harlem on the Lower East Side. And we have supportive housing in the Bronx. We offer testing at all of our sites.
Okay.
And National HIV Testing Day is coming up at the end of June. And we participate with the End the Epidemic citywide coalition, doing events throughout the city. And we also offer testing at all of our sites. It's really critically important to know your status, and if you test positive, even if you test negative, you still want to get into medical care so that you can stay negative, and if you are positive, you want to get into medical care so that you can access the treatments that you need to live long and healthy lives.
New York City seems to have a lot of services for people with HIV/AIDS. Supportive housing, I know, is part of it. Can anybody who is living with an HIV/AIDS diagnosis get subsidized housing or some kind of housing from the city or state, or not?
Well, depending on income eligibility, the HIV/AIDS Service Administration does provide rent subsidies for people who are living with HIV. And New York State also has a 30% rental cap, so that if you get assistance from from Social Security or from disability or from your, if you have a part-time or a full-time job, you have, there's a max of 30% that you would contribute to your rent.
Okay.
I do think that supportive housing programs for people, for low-income New Yorkers facing HIV or other chronic conditions, the beauty of the supportive housing model is that you marry services where people live, and you support daily living skills, budgeting, as well as nutrition and food shopping.
I guess my question is somebody who has an HIV/AIDS diagnosis and is homeless more likely to get supportive housing than somebody who doesn't? I know the city has been making a big effort for veterans, homeless veterans. Do people with HIV diagnosis also get sort of a leg up on supportive housing?
Yes, there is supportive housing projects and initiatives that were created specifically for the HIV population. Mm-hmm. And again, it's about having the income eligibility, being low-income New Yorker and living with the virus. There are supportive housing available, but the truth is, housing is it's a huge challenge in New York City,
right? And
there are insufficient numbers of units available to meet the really high demand. So homelessness persists.
Does everyone who has has been diagnosed with HIV/AIDS have access to medical care?
They should. That doesn't mean that every single person living with HIV has connected with medical care, and that's part of our challenge. And that's what we're trying to do through our partnerships with the hospitals and the health centers, through our utilization of the peer navigators, and through our community centers to really create opportunities for people to access care where they live and where they want to get their care. One of the other things that we do at the Alliance is we're a harm reduction agency. So we meet people where they are without judgment, but with the profound belief in the ability to change. And our goal is to offer an array of services so that folks can pick and choose what is right for them. And we feel very proud to be able to support people on their journey towards health and wellness.
Did the Affordable Care Act have much of an impact on what was available to people living with HIV/AIDS? And are you worried that that could go away under this administration?
The Affordable Care Act has had remarkable positive impacts on people with HIV and other chronic conditions. And I think that I have only wished that more states would have done the Medicaid expansion. My fear about some of the changes in Washington are that the proposed elimination of Medicaid as an entitlement healthcare program, I think, would be devastating, not only for New York City, but for communities across the country. And I hope and pray that that does not happen.
We've got about a minute and a half to go. So what is it like if you're a person in New York City who's living with HIV/AIDS today? What's your day-to-day life like?
I'd like to put it like this. One of our peer educators who did pass away from the virus, her name was Sherry, she said, "I'm not living with HIV. HIV is living with me." People are whole people, and with the treatment advances, they are able to live full and long lives. And as much as we have efforts to end the AIDS epidemic, we will also need to continue to serve people who are living with the virus, who will be living with the virus for decades to come because of these wonderful treatment advances. But there still are health conditions, and we still need to be sure that people have access to the care and the treatment that they need and deserve.
And my understanding is that the drug routine can be rather strenuous. It's not, I guess it depends on how far along you are, but the drugs that you have to take and their side effects?
The side effects continue to be significant, but many years ago there were many pills, and now it's just one in some cases just one pill a day, but you must take it every day. And for anybody who's done antibiotics, you know, it's hard to take your antibiotics every day for 10 days. With HIV, you have to take it every day for the rest of your life. And so we support folks in those efforts, and we're really blessed to have people who are living longer because of these treatment advances.
Okay. Good to get up to date on, you know, what the situation is, because as I said, a lot of us can remember when it was a very terrible, very scary situation, and people were dying. People that we knew were dying.
We're still losing people, but we have many more options available to us today than we did 2 and 3 decades ago.
Okay. We're out of time. If you'd like more information, you can go to alliance.nyc, their website. I want to thank Sharen Duke for joining me for the City University of New York and 1 to 1. I'm Sheryl McCarthy. If there are any people you'd like to hear from or topics you'd like us to explore, please let us know. You can write to me at CUNY TV, 365 Fifth Avenue, New York, New York, 10016, or you can go to the website at cuny.tv and click on Contact Us. I look forward to hearing from you.